come the Republicans. We're expecting Speaker John Boehner and a group of House GOP leaders to come out of their conference meeting and talk about tonight, because probably sometime around 5:30 or 6 p.m., they'll vote to repeal the health care law. It will likely pass the House and then fail in the Senate. Then House Republicans say they will pick apart the new law piece by piece, chipping away at funding. But they have not proposed their own version of what to do about health care. Let's bring in Republican Congressman Mike Rogers, who is chairman of the House Intelligence Committee. Congressman, good morning. Thank you for joining us.
Good morning. I'm glad to be here.
Let me show you a new ABC News Washington Post poll. Even among people who do not support the new law, only 33 support fully repealing health care. It appears you don't have the votes in the Senate to pass this, so why the vote today? Why are we spending a couple of days talking about this?
Well, first of all, it's crushing jobs today, it's raising premiums today, and it's costing small businesses the ability to offer health care today. That's the real problem, number one. And remember, back in the 90s, the Republicans sent welfare reform to President Clinton 3 times. He vetoed it twice before he signed it. And people said, why are you doing it again? It is important that we get out there and talk about the consequences and how much harm this is doing to the economy and to individuals' health care. Once we have that debate, Americans are going to be with us, and they're going to see that there are real alternatives that are more patient-centered than government-centered.
And there have been there's been an ongoing debate about what this means for the economy. Certainly, the Congressional Budget Office, the nonpartisan Congressional Budget Office, has some very real concerns about the cost of repeal, different than what the Republicans are arguing. But let me play for you another argument. This is Chris Van Hollen, what he said on the House floor yesterday.
Sure.
Why not put your plan on the table first so everybody can see it before you begin taking away the important patient protections in this bill, taking effect just since last March?
Is it fair to the American people to say we don't like this plan but not have an alternative ready?
Well, we do have alternatives ready, and if you looked at the substitute that we tried to provide last year, although it got no debate, it is full of great opportunities to reduce costs, improve access without a government-run health care plan. And the first shot out of the box, I mean, think about all the commercials from Geico and Allstate about trying to give you a better insurance product, faster, better, cheaper, higher quality. You never see health insurance because they don't have to compete against each other. So one of the first things we're going to do that we think will lower prices and make it more accessible is allow and force insurance companies to compete against each other across state lines. We've tried to talk about it. They didn't want to hear it. They wanted a government-centered approach. We want a patient-centered approach.
Now you have control of the House. Is John Boehner, are you prepared to put that plan from last year back? I mean, what's going to happen?
Absolutely.
And how quickly?
Oh, absolutely. But the difference is we're going to allow people to talk about it. We're going to have hearings about it. People are going to be allowed to read the bill. I know that's shocking, but we think that's a better way to get to a health care product that, again, makes it cheaper for you to buy, that is less hassles, more choice, and less money. That's what Americans have said they wanted. Instead, they got this huge bill, 2,700 pages, 30,000 pages of regulations. Doctors overwhelmingly are saying this is going to make it harder for them to practice medicine. That's not what they wanted. Let us talk about it. Let us debate it. Let the American people see that there are real alternatives.
Congressman Rogers, thank you very much. I want to go live.